Hi, my name is Terry Dorland with Rise Local TV, and today I am very excited to be joined by Dr. Nicole Patel, who is a cosmetic surgeon in Tulsa, Oklahoma, with the Aesthetic Surgery Institute of America. Excuse me. Dr. Patel, how are you?
I'm good, Terry. How are you?
I'm doing fantastic. It's great to have you here. Dr. Patel, and today we're going to be discussing finding a great cosmetic surgeon. And from your expert opinion, what people should actually be looking for. I mean, there's 10 results on the first page of Google alone. Everyone's got a fantastic website nowadays touting how great they are and the great things they've done. What should people actually be looking for?
I think the most important thing is that you have a well-qualified surgeon, and definitely needs to be a surgeon if you're looking into surgical options for body or face procedures. There are a lot of non-surgeons out there doing cosmetic procedures, and it's definitely not the safest route to go. So you want to look to see, do they have good surgical training, whether that's the route of general surgery followed by cosmetic surgery, which would be your ideal route for cosmetic procedures, versus general surgery followed by plastic surgery, which definitely has more of a focus for reconstructive procedures. And I think, those are very important things. You want to see what kind of specialization do they have, and are they boarded by their respective societies. So, American Board of Cosmetic Surgery is who boards cosmetic surgeons. Have they done their general surgery boarding? Have they been boarded by plastic surgery? There are also facial plastic surgery fellowships. So I think, depending on what you're looking into, you need to look at qualifications. You need to see that they have privileges in hospitals to do those procedures, not just that they're in the office, and should there be an emergency, what will happen? Are there the right safety measures in place at the treatment facility? Is it an accredited surgery center, or does the provider do his or her treatments in a hospital? That's less than ideal because of cost and infection risk. So ideally you want to do things at an accredited outpatient surgery facility. You want to have a board certified anesthesiologist taking care of you, doing your anesthesia, monitoring you during the surgery. The next best thing would be a certified nurse anesthetist. But definitely you don't want something done in the office where the surgeon is also supposed to be monitoring you. That's not the safest way to go, and you don't want to cut corners that way. So you want to research these things online. You want to look up and see if you have any reviews on this surgeon. Are there positive reviews, negative reviews? Look through those. You want to see if you know friends who have had things done. Ask them. Ask about the reputation in the community, which may or may not be feasible depending on the size of the town you live in. I think looking at before and after pictures, making sure that the person you're looking into offers the technologies that you're hoping to learn about or possibly utilize for your procedure. And these really vary greatly, like I said, depending for facial, body, breast surgery. There's a lot of different options out there, and you're hoping that you do your initial research and narrow things down, but then ultimately you're going to have to go in for the consultation and kind of hear what the surgeon has to say. And I would always say plan to go for a few consultations, get a feel for that surgeon's recommendations, what the office experience is like, what's going to happen post-operatively after surgery, who's going to be seeing you, who's going to receive your phone calls if you call in and you have a problem. You want to know the full circle, not just that initial consultation, but then think it all the way through. Think it through. If there is any kind of emergency, what hospital will you go to? Is there an emergency cart in the ACLS trained staff at the facility? These are all important things, and definitely penny pinching shouldn't be your focus when you're looking at a surgical procedure. No matter how minimal, someone will say, oh, no downtime, 1 centimeter incision. These are still surgeries. They still have risks involved. You should understand the risks, the recovery, the downtime associated with everything. So those are very important things when you're doing your research. Definitely you want to look at before and after pictures if they're available, get an idea of, yes, this, you might not find yourself on the image gallery, but maybe find something similar, at least have an idea of the type of results that surgeon is able to achieve. So those are all important. It's complicated, and I think there's a lot more to it than just that, but I think that's a good start. And then definitely be open to seeing more than one consultation, so you have something to base your decision off of.
Well, that makes an absolute lot of sense. And I know you have some really special things that you do at the Aesthetic Surgery Institute of America at your office. Talk to us a little bit about, what sets you apart and what type of experience patients would get if they came in to see you specifically.
Yes, we do have a very boutique office, and it's a modern space, and we focus on patient care, good quality. We want to have a lot of time with the patient. So I spend about an hour with each patient, go through their medical history, learn about any procedures that they've had in the past, what their goals are. This is very important because I can't make recommendations if I don't know what the patient is hoping to achieve. I want to know also about any downtime restrictions or wound healing restrictions. There are times when patients will come in and they have a big event coming up sooner than they'd be able to have their full recovery. And so you want to keep those things in mind before you make recommendations on treatments. We do have all the latest technologies, and it's pretty amazing what there is to offer, both surgically and non-surgically, from laser treatments to injectables to microneedling to fat transfer, slim lipo. I mean, technologies out there, and a lot of them are very effective. Also, there are ineffective technologies out there that do a lot of marketing, and unfortunately it's very difficult not only for providers but for the public to sift through all of that. So when patients come in, I do spend a lot of time with them explaining what the options are for them, what kind of treatment will get them to the result that they want. So say someone comes and maybe their best treatment for the kind of result they want would be a abdominoplasty or a tummy tuck. Well, I can make that suggestion versus, say, another physician who doesn't have a surgical background may tell the patient, oh, well, liposuction will get you what you want. Well, that's because they can't offer the other. So, one of the benefits of being well-trained and qualified to do all the procedures is you can give the patient the best recommendation and give them the, pros and cons associated with each one. So that's very important. I do spend a lot of time with patients so we can go through that, and then they understand what are the risks, what kind of result can I obtain, what is the downtime going to be, and then of course we go through cost as well. The other difference is I perform all of my surgeries at an accredited outpatient surgery center and utilize board-certified anesthesiologists. So patient safety is it's the highest priority for me. Nothing is more important. These are elective procedures. They do not need to have them done. They may feel they need to have them done, but definitely they don't need to. And so you definitely don't want to create a problem or have a problem. That's very important. If we need to do preoperative testing, we do that. We don't cut any corners, and I think that's very important. So other offices, not that they cut corners, definitely not. There are a lot of good surgeons out there. It's just a matter of you see who's the right fit for you, who spends time with you. I'm able to spend the time and do that because that's the quality of practice I want. I am a woman, and most of the patients I treat are women, and so I set up my practice in that regard, knowing that this is how I would want to be treated if I was a patient, and this is what I would expect to learn about, and I want to know my risks, and I want to know the downtime, and I want to know the other options. So I think, I set up my practice in that regard, and so far so good.
It sounds like you've got a great practice, a nice high-end boutique practice, which is, in my opinion, wonderful for patients. And I know you have a really special offer for people who happen to be watching this video. Talk about what that might be to give them the opportunity to come in and experience that difference that you provide.
Yeah, I'm offering a free small area laser hair removal. If you book your consultation with me and you let us know when you call in or when you send us an email that you saw this video and that's how you found us, and then we'll offer you a free, like I said, small area laser hair removal. Typically that's underarms or upper lip and chin, and that can be scheduled independently of your initial consultation. And we'd love to have you call in to us. Our number is 918-939-8339, or you can visit our website anytime, www.nicolepatel.com. And on the contact us, there's both the phone number, directions, as well as email address, and you can email in as well if you'd like us to contact you that way.
Okay, Dr. Patel, thank you so much for being here. You've really provided some great insights.
Thank you.
All right, everyone, thank you for watching, and we appreciate you being here. We look forward to seeing you on another episode of our expert interviews in the future.